CNN published an article that has a lot of people concerned. This article shares the experiences of a couple of people who were diagnosed with stomach paralysis, the medical term being gastroparesis, after taking GLP-1 medications like Ozempic and Wegovy. I'm not going to comment on these individuals' medical experiences because I do not know their medical history and I am not their doctor, but I do want to talk about gastroparesis in general. Gastroparesis is a serious medical condition where the stomach is emptying more slowly into the small intestine, and as a result of that, there can be symptoms like nausea, vomiting, and abdominal pain. And yes, this sounds like a lot of the side effects that we see those taking GLP-1 medications experience. The diagnosis of gastroparesis requires two things. There must be objective evidence of delayed gastric emptying, and this is measured by a gastric emptying scan. So we will actually watch how slowly your stomach is emptying and see that there is a delay. Diagnosis also requires that someone have the typical symptoms, such as nausea, vomiting, and abdominal pain. Gastroparesis, the condition, is something that is distressing to patients. So there must be the positive testing and the symptoms to have this diagnosis. And I want to stress here, if somebody is having such severe symptoms taking a GLP-1 medication, it is so important to stay in contact with their physician because most of us are not going to keep patients who are in severe distress on medications that can make that worse. There are a couple points that I'd like to mention when talking about gastroparesis. With people in general and with different types of foods, the pattern and the rate of stomach emptying can vary considerably. And also, in studies of those with gastroparesis, the gastric emptying time did not necessarily correlate with disease severity. Many medications, including GLP-1 medications, can be a potential cause of gastroparesis, but typically with a medication-induced gastroparesis, we would see the symptoms resolve upon discontinuation of the medication. In the majority of patients, GLP-1 medications are well tolerated and cause a therapeutic delayed gastric emptying, but not gastroparesis.